All right, we ended the last little video clip on why we do a literature review. I mentioned you don't want to reinvent the wheel, and that it really helps you identify the problem and identify gaps, and helps you answer that so what question. You can see the images on the left side of the screen are just a few examples of databases that you guys will, if you have not already, will become familiar with throughout your course of study at Texas Wesleyan. So, all right, what is a hypothesis? I've already mentioned this a few times. It's really a tentative prediction about the nature of the relationship or association between two or more variables. And we'll define variables a little bit later. Another way to look at it is it can be defined as a tentative explanation of a research problem, a possible outcome of the research, or an educated guess about the research outcome. Now you will read in your textbooks and different resources on statistics. They talk about a null hypothesis, and this is really when we're doing hypothesis testing, as when what we're really trying to do is we're really trying to disprove the null hypothesis. The baseline is that we say that there is no difference. The null hypothesis is that there's no relationship, no association, or no difference in the outcomes that you're measuring. But if you do find a significant difference, and many times this is related to when we have statistical significance, which is commonly having a p or a probability of less than 0.05, which means there's only a 5% chance that you found a difference when really no difference exists. So that's what we're trying to do, is we're trying to disprove the null hypothesis and state that in fact there is that our hypothesis is correct. To continue to go back to this concept of differences between a purpose statement, a hypothesis, and a research question. Here's an example that I think helps you think through the different ways we would go about these. So when our students were designing this particular study, they developed this research question, and we spent weeks with them really fine-tuning this based on their review of the literature. Does a 30 ml saline bolus decrease the time to full motor recovery following labor analgesia in parturients with a PCEA infusion, as you can see listed there, when compared to no normal saline bolus? So that's a nice research question. I can see there that my outcome is time to full motor block recovery, that my intervention is a saline bolus of 30 cc's. My population are parturients with a dilute local anesthetic PCEA, and my comparison or control group are those who don't get that saline bolus. So we would hypothesize that there would be a significant decrease in the time to full motor recovery in that same population and parameters. If we were to write a purpose statement, and this would be what you may read in the published article, is that we want to determine if the injection of a 30 ml saline bolus would decrease the time to full motor recovery following labor analgesia in this population. So you see how those build upon each other and how they're slightly different depending on the context in which you're using them. Another example, in this particular study, we had a primary research question, or a primary aim. Our primary research question was the time to full motor block recovery, and that's what we based our power analysis and sample size calculations on, which we'll talk about in later lectures. Our secondary one was looking at time to 2 dermatome regression, which is when the students did their literature review, they identified that as an important outcome variable, but that many of the studies looked at. And you can see, and you can read through here, the different ways we went through the research question, developing our hypothesis and our purpose statement, looking at that particular outcome. I just mentioned this I know it doesn't. It probably seems a little out of place, but I just wanted to mention it for completeness. It's called data mining. So what is that? It's a process of discovering patterns in large data sets, involving methods that intersect machine learning, statistics, and database systems. And the goal here is really to extract information from a data set and transform it into some sort of usable structure. Sometimes you may read in literature, people may, they may be doing data fishing, data snooping, or data dredging. It's where they may be using data mining to uncover patterns or relationships between in large data sets. For example, here they found this relationship that looks like there may be a significant relationship or correlation, but it really doesn't mean anything. And they're saying here, just an example of letters in a winning word, a script's national bee correlates with the number of people killed by venomous spiders. Looking on the graph, it looks like, man, there's something there, but in reality, there's really nothing. This guy Tyler Vigeland talks a lot about spurious correlations, and there's some resources later in the lecture that we'll talk about, but I just wanted to throw that in there. So next we are going to talk about collecting the data. So what is data? Data are observations of random variables made up of the elements of a population or sample. Data are the quantities or the numbers, or the qualities or the attributes measured or observed that are to be collected and or analyzed. Data can be plural and datum is singular. Oftentimes you'll see what we call is a data set that a researcher may use after they've collected their data from individual subjects and they put it into a database. What are ways that we collect data? Well, there's primary sources, in which case these are how you go about collecting data. This is data that is not already available to you through either survey, observation, experiment, or simulation. Secondary sources, these are already available. For example, they may be published sources. They may also be medical records. They can be either external, which for example might be, say, the NBCRNA database, or in the military, the Joint Trauma Theater Registry. The CDC has a number of databases, closed claims malpractice database, or even investigator-developed data sets. An example of an internal secondary source would be inpatient medical records that many times researchers and even some of you may have used in the past for various projects. And in many studies may use a combination of primary and secondary sources. So what's a survey? This is the most one example of a way that you can, a primary source, the way you can collect data. And that's probably one of the things we're most commonly familiar with. I know every year, if you're a member of the ANA, you get that annual survey on compensation and benefits. You get a little link, and they ask you to go through the questions. And they keep the questions fairly similar every year so we can compare year to year. But surveys can be done most commonly these days on the web. You get an email link. They can be done in person or by phone. They can allow us to collect information on emotions and on how people feel. It allows us to collect a lot of information with a limited amount of resources. Another example is an observation, and this is where this researcher observes and records behaviors without influencing or interfering or assigning people to treatment or control groups. For example, a research question may be, how often do healthcare providers in an academic medical center wash their hands? I apologize, there's a typo there. So here, example, you may design this simple study, and then a medical student observes providers for a day and records yes or no, do they wash their hands between patients? He also records how long they washed their hands and what provider type they were. And then maybe he compares or describes the differences between doctors, nurses, and nurses. And he may even examine if there's an association between provider type and did they wash their hands, yes or no, or for how long they wash their hands. And so that would lead to different types of statistical tests that we may use. Another way that we most commonly see when you hear about observation is that we may do what's called observational or descriptive studies. For example here is that a CRNA researcher wants to determine if a higher stop bang score is associated with complications after surgery. And so he prospectively follows 100 patients without interfering with the type of anesthesia. He just simply enrolls the patients in the study, collects some baseline data, and then tracks them throughout their course during the perioperative period, and just records what happens without any manipulation. Then what he could do is, if he had them fill out some simple questionnaires, maybe he had them do the stop bang, and so he can calculate the overall raw score, and they can break them up into a score less than 3, 3 to 4, and greater than 5, which are a common score. So he can categorize that score. And then he can look and see if there's differences between those 3 score groups and complications. An experiment, this is what you read most commonly in the literature. This is maybe what you might think of as that randomized controlled trial. An experiment and a randomized controlled trial is really considered one of the highest levels of evidence, just below a meta-analysis or a well-designed meta-analysis systematic review. And this is what allows you to examine causality. You cannot examine causality with survey or observational studies, or even descriptive correlational, or studies that do some sort of a regression analysis. That doesn't really get at causality. And to examine causation, you've got to eliminate or control for all other factors that might impact what's called the dependent variable, or you can think of that as your outcome, while you manipulate the cause being studied, which is the independent variable. In a classic experimental design is where you randomize people to 1 or 2 groups, and that randomization essentially helps equalize the group on key characteristics and helps minimize or reduce what we call bias, so that we can conclude causality, and it helps to make sure that the groups are as similar as possible for any known or unknown confounding variables. And you can see the example I have listed here, the study we talked about, where our treatment group was a saline bolus, a control group was no saline bolus, and our outcomes are a dependent variable were time to full motor recovery and time to 2 dermatome regression. So I'm going to pause right there, and we will resume here in just a moment. Or what you can do is just click on the next link when you're ready.